All right. Hello, everybody. Thank you so much for tuning in once again. I really love doing this podcast and interacting with all of you and with my guests, of course. Thank you so much for coming on. Today, we're going to talk about a very important topic. We're going to talk about the plight of the contract healthcare workers in Malaysia, especially during a pandemic, right? Things are so uncertain right now. And the pandemic is not getting any better in Malaysia. And the people that the frontliners are the ones that we depend on to screen people, treat people, and even vaccinate people. So this whole issue has blown up. Now there's a whole movement. Hashtag Code Black MY, hashtag support healthcare work contract HCW or healthcare workers. So with me today we have the chairperson of MMA-SCHOMOS, Dr. Vijay Ganasan. Good evening, sir. How are you? Yes. 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 My pleasure. And what color shirt are you wearing, Dr. Vijay? Nice. Ngam black, huh? Yeah. Yes, yes. If you could do me a favor, could you, whenever you speak, put the mic closer to your mouth, because I think, yeah, now it's beautiful. Okay, so later we're gonna take questions regarding this whole issue, but I just wanna before we go into the issue, I just wanna ask, you are in the thick of things with regards to the contract healthcare workers, and the contract healthcare workers are the workforce in this pandemic fight. So, what's the current situation now? Like today, we have 8,000 cases. Is there anything that you can offer to our viewers today? Like, how is our battle going?
whether they're contract or whether they're permanent, are currently tired. They're tired, they're fatigued. Yes, of course.
Okay.
They're tired, they're fatigued, and I think we all need to support them. And one of the main reasons that I actually came on the show as well is, I think the public needs to understand that these healthcare workers, I mean, we all have a certain amount of energy that we can sustain in ourselves, but there would come a time that we tire ourselves as well.
Mm-hmm.
And I think there have been some pictures circulated on Facebook and all that. I'd not comment much on those pictures, but this is the state we are in currently. And a lot of us are currently, as I mentioned, tired. So we hope that the public will not only support the doctors in our call for solidarity, but at the same point of time, if possible, stay at home if you don't need to come out. Stay safe and maintain the SOP that is needed, wearing a mask, social distancing, practicing social distancing. I believe certain areas are still packed with people when it doesn't need to. Yeah, so I think Jason, back to basics. We need to be how we were last March.
As in March 2020 or March 2021?
March 2020, sorry.
Yes,
March 2020. I think things were quite good at that time. And I think in the Klang Valley at this current moment, I was a bit shocked looking at numbers today. And I hope that as many as possible will recover, if possible all. But a gentle reminder to the public and to all those listening out here, let's keep safe.
Mm-hmm. Okay. On that note, I think for me, I think the public and the rakyat are doing a pretty good job listening to the SOPs. I just feel that the powers that be are the ones who are not adhering to their own SOPs. I won't put you in the spot. I know you can't really comment on this, but I feel that right now we are at the tipping point of the pandemic, and yet people prefer to hold meetings late in the night just to for their own sakes. Now, I've been receiving some texts from my friends who are the frontliners. I won't name them, but yes, I agree with you. They are saying that they are feeling burnt out. They're feeling depressed. Some of them say that it's scary to see that the healthcare system crumbling. Now, on that note, I want to ask question on two fronts. First one is, do you think the healthcare system is close to crumbling or about to crumble, or is there still reserves as buffer, right? Because the people are quite scared, like when they see videos of hospitals being overcrowded, no beds outside the ER, the ED, the oxygen tank shared by I don't know how many people, we get scared. So are there enough resources left? And on the second front, how bad is the burnout rate amongst the frontliners?
Okay. Thanks, Jason. I think certain hospitals are actually close to crumbling. I think certain hospitals are close to crumbling, and I think we have seen enough of the comments, especially on the social media, regarding this. I think this is something that we don't have to hide, but instead it's close to crumbling. If you ask me, what stage are we at? And when you mentioned regarding the burnout rate and all that, in fact, MMA itself did a survey in which we had actually applied for the registry and all that, and we found out that actually more than about 40% are actually burnt out. And this survey was actually done, more early this year. So I can clearly say at this stage, I'm looking at something of about more than 50%. But what I must remind the listeners especially, is the beauty about our medical profession is none of us have given up and none of us have stopped serving the people. So I think this is something that we need to thank the doctors. And I think they're doing a pretty good job, but just that at the same point of time, maybe a little bit of appreciation for these doctors. I think that would be something really, really good that we can look into.
Okay, that's a really good word that you mentioned, a keyword, appreciation. I think not just during this pandemic, or not just among contract workers. I think throughout eternity, or it feels like eternity in Malaysia, like public doctors are not given enough appreciation in terms of money and perks, but we'll get to that in a bit, right? So I understand that your background is as a psychiatrist, and you were in Sarawak at the time. I just want to ask, like, right now, what can the people do to combat this whole pandemic, lockdown, fatigue, depression, and what can we do to help, apart from staying at home, what can we do to alleviate the psychological burdens on healthcare workers?
Okay, apart from staying at home, well, if you ask me at this stage, I would surely say wear black on 12th of July. That's the first thing that we can look into. We are looking at Black Monday, and what we are asking for is not really only doctors to be wearing black on the day. We are looking at everyone. If we could get 1 million people to wear black, trust me, this is a huge appreciation that the doctors will see. And I think the doctors would love to see that, if you ask me. And maybe not all will appreciate, but at least we know there's someone out there, someone watching on us, someone to support us. What doctors need actually is this kind of support. And besides that, you asked what can we do besides the SOP and all that. Yes, SOPs are in place. Enforcement is also in place. But I think the other thing that the people can also do is perhaps a token of appreciation, not in terms of monetary or anything like that. But
sorry, Dr. Vijay, can you put your mic close to your mouth? So sorry.
Sorry.
Yes.
When you see a doctor, or when you approach a doctor in the medical field, wherever it is, whichever hospital it is, a lot of time we have seen a lot of negative remarks about doctors and all that. This I would like to make a little shout out, not only to doctors but to all healthcare workers. I think a small appreciation from the public when you see a doctor, when you see a staff nurse, when you see a pharmacist, when you see a dentist, a simple thank you or simple smile, or doctor, you're doing a good job. These kind of things that we say to them would perhaps alleviate their mood. And many of the times they just continuously work without knowing day and night. So when you go and give them good comments, good criticism and all that, and tell them how valuable they are to the system. I think these are things that it may seem small. It doesn't cost any money at all, but it makes a huge difference in doctors.
Okay. So I'm hoping that among the viewers we have tonight, I'm hoping that a lot of them are healthcare professionals, especially those who are on contract with the government. I hope you guys are tuning in. If not, please tell your friends who are contract healthcare workers to tune in, okay? Because I think it's very nice that we get the chairperson of SCHOMOS to have a chat, and later on we'll take questions. So please do join us. Tell your friends who are contract healthcare workers to join us, okay? So the meat of tonight is the whole contract doctor issues. Now, What exactly is the issue, and how did we come to this issue? What happened?
Okay. A bit about the background. In 2016 December, the government had announced that all government doctors, in fact, healthcare workers as well, would be put under the contract system. Meaning, prior to 2016 December, all of us were considered to be permanent. In fact, even I'm permanent.
Okay.
So when you're in the permanent system, what happens is you do get all the government perks in terms of leaves, allowances, everything. And you do have a pathway for career progression, because when I'm permanent, basically I stay in the government service until I decide to quit. Whereas in the contract system, what happens is they're given a 3+2 contract for the house officers and medical officers, and subsequently they do not know where they go.
What do you mean by
So-
3+2? 3 years guaranteed, and +2 is KIV?
No, the 2 years will be as a medical officer. But however, that it's a bit tricky when we say 3+2. Maybe I put it as 2+1+2. So that's a bit more clarity of 2 years of housemanship, and then 1 year in case there's any extensions or anything per se, and then another 2 years as medical officer.
Okay.
Now,
And then
while
beyond
we
that,
say-
it's God bless you lah.
Uh, well, I wouldn't put it that way as God bless you. Indirectly, I have to admit, it is. It
Okay.
is. We do not have a proper system
Okay.
in place yet
Okay.
to actually say that what happens after the 5th year.
Okay.
So I think as time has passed, since December 2016, 5 years down the line, we are approaching December 2021. And as we approach December 2021, a lot of these doctors are thinking, where do I go?
Okay.
What do I do after
I see.
2021? And how do I progress? Because let's take it to an example. Let me give you a simple example of 2 years housemanship are finished. Then I'm posted to a district or something
Okay.
per se. How do I complete my specialization in time? And at the same point of time, these doctors are also not given the opportunity to get the HLP, which is Hadiah Latihan Persekutuan, to pursue their masters. So let's say they go into the parallel pathway. They still need a place to gazette after completing external papers. How do they do that? So all these questions are stuck in their mind. And at the same point of time, think about it. As a doctor, I want to buy a car. I want to buy a house. Could I go and get a government loan for this? I'm a contract person, and they know that I may not be eligible for this loan. So this has also resulted, I must say, in some of my juniors. I do know of 1 or 2 who ended up even having to drive Grab just to
A junior doctor driving Grab to make ends meet.
Yep.
Okay.
I'm not looking down on Grab. I've got nothing against Grab. In fact, I'm a fan of Grab. But at the same point of time, looking at having to have 2 jobs just to maintain a job security without knowing where to progress in your career, I think these are issues that we really need to look into. Especially
when a doctor should be focusing as much of his or her energy into, progressing along the pathway. It's this kind of distractions which are no fault of the doctor, foisted upon them. So it's very unfair.
Yep.
I want to go back to the root of the problem. So suddenly, after 2016, all doctors are on contract basis and not permanent basis. But the layman mindset is, we always need doctors. We are always not enough of doctors. So why suddenly, instead of guaranteeing everyone a permanent position, they have put it on this contract basis? Is it because we have already too many doctors? Has the issue of not enough supply of doctors been magically solved?
I do not agree if we say that we do have enough doctors. In fact, if you ask me, I wish we had more.
Okay.
I really wish we had more.
Okay.
The current ratio that was mentioned was 1 to 454, meaning one doctor to 454 patients.
Okay.
Now this was the current ratio that was mentioned.
Okay.
But if you look at this, we can't just take that as a general number.
Yes.
Number one. Number two, how many specialists do we have?
Yeah.
Look around us and let's ask ourselves how many sub-specialists we have amongst us. Like, for example, just choose what was your favorite subject in at med school, Jason? Let's just choose surgery. Okay, let's just give an example. How many pediatric surgeons do we have around Malaysia, for example? So I mean, I'm not pinpointing just this particular sub-spec, but in reality we do not have enough numbers. And how to reach that level when we don't give the chance to these medical officers. So if you ask me, whether numbers are sufficient, the answer is surely no. And one more thing that I just mentioned in my previous meeting at about 6 p.m. today was we should look into things things like universal health coverage and things like this. WHO has recommended, in fact, a doctor-to-patient ratio of 1 to 2 to 5.
Okay.
So, in fact, just look around our neighboring countries as well. Many of the countries are actually going way lower than this ratio. So, I think moving forward in the future to come, we need more and more specialists. And I just want to quote our Minister of Women and Welfare, YB Dato Sri Rina, who actually mentioned that our population is aging. There's no way of escaping this. We all have to age.
Okay.
In fact, you and I may be, full of white hair 10 years down the line, and this population is increasing to 15 to 17%. And with that disease burden and the illnesses that come along with
down
that,
the line,
there's no way that we can actually say we have enough specialists.
Okay.
In medical, the demand and supply grows linear. They are nowhere near inverse. It's always linear, where when the demand increases, the supply needs to increase.
Okay. So that brings me again to the question. So why suddenly the government decided, okay, all on contract? Did we run out of money? Why suddenly? Because to me, it only makes sense if we have too many doctors, so we got to stop the intake, or we run out of money and we can't continue paying them. So why suddenly like this?
I wish I could answer that question.
Okay.
What we were told that was regarding the number of doctors coming out, and also in terms of feasibility of budget and all that, that needs to be taken into account.
Okay.
Now, while I may say that, I believe that, of course, not only MMA, a lot of other associations have constantly been saying that healthcare budget is one that's always priority. And I think quote by Mahatma Gandhi, there's no there's no wealth without health. So you need health before you can touch that wealth.
Exactly.
So I think we need to increase our budgets as well.
Okay. So now this issue started, after 2016, but now during this pandemic, it has reached critical mass, right? So what is the situation now, and what is all this Code Black movement, Black Monday all about?
Okay. Let me just brief you a bit about Code Black and Black Monday. Code Black and Black Monday was actually launched 2 years back. The thing is, we never had a public announcement of this. The reason being, at that point of time, we were fighting for a few things. One was contract. The other one was the UD 41 and 43 implementation. And the third one was the critical allowance. If you notice, in the year 2020, in fact, I was the one who started the petition for the critical allowance for doctors, and we managed to reach 120,000 signatories in 4 days. So this was then presented to the government of the day as well. And
this was because the government of the day then decided to stop the critical allowance, and you championed for maintaining the critical allowance, right?
Yes, they did not stop yet. There was news that it was going to be stopped, and it was going to be implemented a few months later. And we put in our petition of signatories done by MMA, and we got this tabled.
Okay, and just curious, so for the average new doctor, young doctor, how much is the critical allowance, and how much does it make a chunk of the total take-home pay per month of a doctor?
Well, you're meaning for house officers, or?
Okay, say for house officers, the new doctors.
Okay, it's quite a big chunk. I wouldn't want to mention exact numbers, but probably at least about 15%.
Okay.
I don't have the exact percentage, but at least I would think it's ranging between 15 to 20%.
15. Yep. So 15. So So thanks to you, you saved the 15% of the young doctors' pay. Okay. Okay. Then after that, what happened?
I think thanks to the 120,000 signatories, not thanks to me, but this is where we should unite and we should be together, because this is very important. We need to stay together, and amongst doctors, we should not split. And I've said this again and again, we should not split or fight amongst doctors. We are actually fighting for the same goal, and the goal at this time is actually for the contract doctors.
I see.
Yeah. So you mentioned
you mentioned something about the unity. Yeah. Say you want to say something?
No. The next thing that we actually managed to champion was the UD 4143 implementation.
Okay.
In which previously, once you become a medical officer, you're still in the UD 41 grade. So this
Yes.
was something that also championed by the Malaysian Medical Association,
Okay.
and thanks to various parties as well, we got that sorted out as well. So
Okay.
this was why Code Black, or rather Black Monday, was not launched yet at that time,
Okay.
as we were still having continuous meetings with the government. In fact, if I were to count the number of meetings, I would say at least 40
Okay.
meetings
Okay.
that we have actually been with the government. Yes.
So okay, for all the viewers who may not be aware, UD41 is uh, your pay scale, your pay grade on the
Yep.
pay scale. So when I started working as a house officer, this was in 2009, 2009. UD41, I don't mind sharing. It's about, your take home pay is about 5,000 ringgit, including your allowances, your on call allowances, critical allowances, and also like your EPF and whatnot lah. Okay, so about 5,000 ringgit. And after 2 years of working, you become a medical officer. Okay, but at the time when you became a medical officer, refresh my memory, we were still UD41. Am I right, Dr. Vijay?
No, once you become a medical officer, you become UD44 as permanent.
UD44, yes, okay.
44, yeah.
So 44 was a pay grade. So now UD43, when is UD43 implemented then? Before you become a medical officer?
This is in the contract system.
Oh, no, for the contract system. Okay, you're right.
For the contract system.
Okay,
yeah.
that's right.
So initially there was those who were serving as contract and permanent, which they were doing the same job, but one was being paid way lower.
I see.
But I must thank the ministry for this, because the implementation has been done, and most of them have already received their backdated pay already. So this part was sorted out.
Okay. Yep. So now I get it now. So just for the viewers again, so the initial problem was contract house officers, they were paid UD41, and then when they became medical officers, they were still being paid UD41 salary, as opposed to the permanent doctors who were paid UD44 salary. So yep. I see. I get it now. All right. Okay. So now, what do we hope to achieve with this Black Monday Code Black movement? Do you think we'll be successful?
I think the success actually depends on the people.
Okay.
We need the people. Okay. More than anything else, we need the people, the doctors, the dentists, the nurses. In fact, we do have a healthcare group in which we do work together with different various healthcare workers as well. And we just had a meeting with a few of them yesterday and today. Few of them are on board as well. We also hope that this contract issue is given an extension, and this is extended also to pharmacists, dentists, nurses, medical assistants, anyone, even all our allied healthcare workers, I think, deserve a fair enough answer to this contract issue. Yeah.
Okay.
And you asked what are we trying to achieve? I mentioned the numbers.
Yep.
And we hope, Jason, I think you know a lot of people out there, and if you could spread that the way we spread love, if you can spread the word around to wear black on 12th of July, that would help us a lot.
Yeah. So you hear it from the horse's mouth. Please wear black on the 12th of July. And more importantly, I may add, Dr. Vijay, take photos of yourselves wearing black, post it on social media, let people know and hear your cries and your pleas. Just a funny story. A few days ago, I posted a photo of myself wearing black, and the photo I edited to make it black and white. I put it on my Facebook page, and some people thought I died. Some people thought I passed away already. So they were sending condolences. All my parents panicked. So it's apparently very superstitious among Chinese people to post photos of yourself in black and white.
Okay.
Yeah.
Well, I hope the issue to the contract system dies off.
Hey!
I hope this issue dies off.
There we go.
I think that should die off, because it's been too long, 4 to 5 years, and I think it's time that we come with a result.
Yes, I agree. Although, and this is my opinion, of course, not an opinion endorsed by you, but when I was in the healthcare service, the one thing that pushed me away was the bureaucracy, but I knew even then that the jewel in KKM was the healthcare workers, not me, but the doctors, because even though our pay wasn't that great, our career pathways weren't that great, a lot of things had to be managed, but we still gave pretty good service to the people, and I think Malaysia's healthcare system pre-pandemic, of course, was pretty good. We actually had, in a way, in a manner of speaking, universal healthcare. Anyone could walk into hospital, 1 ringgit, 5 ringgit, and you won't be turned away. You will not be turned away. That's the main crux of the issue. But like if you go to America, other countries with privatized healthcare, if you don't have enough money, you will die. But at least Malaysia will still take you. And I think I agree with you when you say that it's time our healthcare workers get a fair shake, fair deal, especially those who are on contract basis, because they are the youngest. They are just starting their journey, and they're already being burnt out by a pandemic and also a rather unfair system, I should say.
Just to add on, I think you mentioned that we were the jewel of the ground at the time. In fact, if you ask me today, I would still say that the contract workers are still the jewel.
We are,
because
exactly.
They do not have an answer to their job security and all that. But yet, I have not seen. Of course, there are some who have already resigned, but I've not seen a lot of them. The majority of them leaving, and in fact, they are still tirelessly working on the grounds. And in fact, we also saw some who were resuscitating patients, and I think these are the real unsung heroes that we need to applaud.
Yeah, exactly. I totally agree. You know, especially now in this pandemic, for me, it sounds crazy that it's like we are having a war, but you can't guarantee your soldiers benefits. Hey, come and fight for me, die for me, but after that, we're not sure whether we still need you or not. Like it's quite incredible. And my own personal speculation is that this is all down to money. Maybe the government doesn't have enough money, but I remember that in the early days of the pandemic, there was like 500 billion ringgit announced by the then Prime Minister, by the Prime Minister to help fight the COVID pandemic. Isn't there a way that a chunk of this 500 billion could be used to pay the salaries and sustain the salaries of the contract healthcare workers, and then switch them to become permanent healthcare workers?
Well, budget-wise, I think there has been certain allocations every year, but I think we need to look into, if you say in terms of budget, I would like to break it up into two, which is one would be the acute stage, and the other one would be probably an intermediate or long-term plan.
Okay.
Now, during this acute stage, if we say we don't have money, what MMA has previously suggested and would like to suggest again is that let's repurpose funds. When we say we don't have money for COVID, I'm sure the tourism industry was actually shut during COVID. A lot of the tourism industry budget was not utilized. So let's try to utilize those kind of budgets. This is just an example. I'm not quoting any specific ministry, but this is just an example of how we can repurpose funds. Now, the other way for an intermediate or a long-term plan, of course, the budget of healthcare has to increase. And I think another thing that they can consider is perhaps, you mentioned you go into a hospital for RM1 and you get everything done. You get a CT scan, you get a blood investigation, you get everything. Now, I do understand, especially during this pandemic, the worst affected people are probably those in the B40 group. While we should not affect the B40 group, I think an increment from that RM1 is timely.
Yeah.
I don't have the exact date. I think it's 1982.
Yeah.
I think it was 1982. I really can't remember. So I think it was 1982 that it was then charged RM1. And I believe that since 1982, even the parking ticket at the hospitals have increased much more times compared to the $1 that one goes in to get every single investigation. So I think if we don't have the budget, let's look into certain increments which should not affect the B40, but we should be able to. I mean, if you ask me, can I go into a hospital, pay 5 ringgit for every treatment, get all investigations and come back with medication, I would surely be willing to say yes. And this is where the public support also has to come, in which this increment, I'm only suggesting RM5. Of course, this has to be studied, but an increment at this stage is timely.
Yeah, and this kind of increments, I totally agree with you, because yes, of course, people who cannot afford, they should be given some sort of pathway or leeway in terms of paying for healthcare, of course. But we need to increase something. Right? Even I would argue that contract workers aside, the salaries of doctors should be increased also, because when I started working, again, 2009, that's like 12 years ago, the salaries are almost the same now. But everything else has increased. Housing has increased. Insurance has increased. We all need a smartphone now, which is costs a few thousand ringgit. You know, our gadgets and electronics all much more expensive. Cars are more expensive. So I don't have the studies to prove it, but I know that the doctors that start working today, even on permanent basis, they are twice poorer than I was when I started working. So we definitely it's far beyond time that we increase the doctor's pay. That's something I feel very passionately about.
Yeah. I would surely agree with that. And if you could put this through, that would be great.
Yeah.
But at this stage, my focus is surely on the contract workers. Surely.
Yeah. But I've been saying that many times. You know, I use that example. You know, like 12 years ago, salary same, but as now, you know, but you know, everything has gone up. Housing has gone up. House prices have gone up twice, 3 times. So it's very easy for people to see, oh my God, you're right. So I pity the doctors who start working now. My juniors, 12 years, my junior, I don't know how they cope. I don't know how they survive on 5,000 ringgit a month. You know, one other thing, okay, I won't ask how old are you, but I feel like we're in the same generation, especially when we started working.
You mentioned you started in 2009.
Yeah. When did you start?
Yeah, mine was 10. Surprisingly, my date was put as 10th October 2010.
Oh, you started
working? Actually 11th.
You started working on 10th October 2011.
2010.
2010.
It was, the first letter that I got, there was an error on the date. It was 10.
Ah, okay.
Yeah.
Nice. Oh, so technically you are also 1 year my junior lah, but you are now chairman of SCHOMOS and a psychiatrist. I'm just a professional joker. Okay.
Professional joker, but one that has many more followers than me.
It's okay. You need to get on social media. You know. Okay. So since we are roughly the same generation, you remember when we started working, right? Whenever we complain about like, hey, you know, hours are too long or too much work, you know, our seniors would jump on us and go, you know, back in my day, you know, I would crawl to work on broken glass. You know, I would be on call 42 hours a day. You know, never sleep. You know, eat food in the toilet. You know, that kind of stuff. Like, you know, it's like, don't complain because we had it tougher, right? Right now, I think that the seniors are more supportive of the juniors in this issue than previously. Now, do you feel that's correct? Are the seniors more supportive now, or it's still the same? Like seniors, like, hey, you know, don't complain. Last time we had it worse.
I think you're perfectly right. And in fact, if you look at this contract doctors issue, in Malaysian Medical Association itself, I must comment that in Malaysian Medical Association, we have 2 sections, which is the SCHOMOS, government side, and the Private Practitioners Society section. So I'm getting a lot of support from the private side, in fact, and these are seniors who have already left the government service or probably who opened up their GPs and all that. They are actually supporting us a lot, really a lot. And amongst my circle of people as well, a lot of seniors are actually supporting the juniors. Of course, you can't say that, you know, there's no senior, junior kind of issues happening in certain hospitals and all that. I would not comment, but I think it's much lesser. It's much lesser, and we are all fighting for one goal at this time. Yeah,
that's nice. I think, you know, I it's like, and when I say seniors, I actually mean doctors our generation, because we are now the seniors, right? Doctors, like we are now the seniors, and it's nice to see all my, you know, my former colleagues, former peers now supporting the juniors. It's very nice, because I'm pretty sure if this pandemic happened 12 years ago and this contract issue happened 12 years ago, I have a feeling that maybe our seniors will not be as generous then. So okay, I just want to ask, so I have to ask this because this ties in very deeply with what we're talking about. There is a strike planned, not by MMA, not by SCHOMOS, but another group of anonymous doctors, I understand, who want to have a strike where they will, walk out and not render services on a particular day to make the point across. Now, what is MMA and SCHOMOS stand on this? I know you're trying to distance yourself away. What is your stand?
Okay, we don't. I'm not trying to distance ourselves away. Just that we don't condone the strike. Okay. We don't condone the strike, and our stand is as simple as that. But we will not stop supporting these junior doctors. Okay. We are not condoning the strike, but we are fighting for them. I understand. We are fighting for them, and as you can see, you mentioned about senior, junior. A lot of people, the majority of people that are fighting for them, that I can see, are actually those permanent and those who are senior.
Yes.
So so I don't want to say that we are opposing the strike or anything like that.
see.
Just that from our stand, we do not condone the strike.
Right.
But otherwise, we are fully with them to support them, and we hope that this whole issue. In fact, I've given myself this is just a personal basis. I've given myself 2 to 3 months to get this issue sorted out. I don't have the power to sort it out, and I shouldn't be the person who decides on the 2 to 3 months. But I'm accountable for my position as chairman of SCHOMOS, and I do want to see some change in time to come.
Right. And you must understand, it's very nice for people to hear someone in a position say accountable for my position. Other people are just counting on others for their position. But thank you, Dr. Vijay. That's very nice. Don't have to implicate yourself any further. I really appreciate your words. So I understand that by having this, we don't condone the strike, but supporting them. You don't want to break the solidarity between doctors. Yes. Am I right? Because that is an important glue holding this movement together.
Actually, I don't see them as a separate entity.
Okay.
In fact, I see them as doctors. And after the past 3 days of our meetings, it has gone beyond doctors, if you ask me.
That's nice.
As I see healthcare workers as one. Okay, because we are not going to be working in a ward without a staff nurse, and we are not going to be prescribing medication and not expecting a pharmacist to supply medication. We are all in the same circle that we need to support each other. So I think moving forward, we need to look at it as healthcare workers.
Okay.
Yep.
I really hope that this issue gets resolved soon. It just saddens me. To all the viewers here and also on YouTube and Facebook, we got a healthy number. We're gonna take questions later on, and Dr. Vijay has very kindly agreed that we're gonna take questions. Just listening through, there's one here which I think is good. Is a nice time to address now. Dr. Vijay, I would appreciate if you could share how by wearing black on Monday helps create awareness or improve the current situation. Does it work the same way by getting 126,000 signatures to be presented to the relevant parties?
Thank you for the question. Now, during Breast Cancer Awareness Month, we wear pink, and there's a ribbon that we wear to create awareness. I think the answer of that same question of wearing black is the same to the breast cancer awareness or any other awareness campaign, that we stand in solidarity. Now, wearing black will not change. You can wear white, you can wear black, you can wear green if you want. Doesn't matter. But what we want to show is that we are all united and we stand as one. And that's most important. The color black does not specifically say that, if you wear black, you are supporting, the contract doctor issue will be resolved. No, it's just the numbers. It's just the numbers. And hence, unity. Unity amongst doctors. Will it be better than the 125,000 signatories that was obtained and all that? No, and that is one of the things that we have actually planned after the 12th of July. So the 12th of July is a beginning of it's not the end, but it's probably a beginning. Although the Code Black started on the 1st of July, but the Black Monday will be a beginning of something that we are going to go all the way to fight for the contract doctors.
Okay. Now, just curious, why black?
We have different colors of code in the hospital.
Okay, yes.
And I think, and that's how we came about black. And in fact, this Black Monday was something that we actually planned, like I said, 2 years back. So the color black had actually been decided even then. And in fact, we wanted to have a slight change to the name, but in respect to our seniors and the people who actually started all of this, we decided to go ahead with Black Monday.
I see. Because if you want to talk about colors in hospital, I think almost all the colors are quite scary. There's code red, means the patient's bleeding. Code blue, patient cannot breathe. Code black, patient probably died. And then code orange, child is missing. So all the colors are scary in the hospital.
I hope we don't have to see all those colors.
Yeah, exactly.
But,
right.
Yeah, it is scary, but we have to choose something that probably helps us the most. Yeah.
I feel that after a while, there'll be no more colors to choose, because like red is taken by some political party, then yellow Bersih, then green is some other political party, blue is another. Then we no more colors today, bro. What other colors are there left?
I was a bit shocked as well, Jason, because about a week ago, we also had some authorities asking us if we were in the Black Flag movement.
Oh, yo.
And with that.
Yes,
and,
yeah. Okay. Then.
So we were a bit stuck, but so we had to clarify this, and in fact, our president came up with a statement stating that we are not in the Black Flag movement. I mean, you're free to support if you want to support, but MMA is not the one organizing the Black Flag.
Yeah, it really
so
isn't.
we were a bit stuck actually, but thank God that was clarified. And in case it's not clarified, I hope the authorities how to say.
Listening to Dr. Jason Leong's podcast.
Yeah, exactly. And letting the people know that we are not the organizers of Black Flag. We clearly have stated that we do not, what we want is the code black. And in fact, this code black is often used to refer to a hospital emergency, for example, a bomb or a personal threat to its staff.
Yes.
So what we are asking is not a threat to the staff. I wouldn't put it as a threat to the staff, but
it's
I think
an emergency nonetheless.
Yeah, exactly.
Urgent attention is required. Yeah.
Correct, and this is for the staff.
Yeah. So just to shout out to everyone who wants to support the Code Black movement, don't wave a black flag. They want very different. Very, very different. So don't conflate the two. Okay. If you support both, that's fine. But remember, if you want to support Code Black, don't wave the black flag. Okay.
Yeah.
But
if you decide, even if you decide to wear the black flag, just hold it with healthcare workers or something like that. I hope they don't put up our faces and all that on the flag. And I don't mind being PM, but I
think that would really make your parents go into a panic. Like if someone waves a black flag and then your face is there, Dr. Vijay, SCHOMOS, okay. You have to issue statement after statement. Okay. There's a question here which I think is very important. What if someone, a healthcare worker, wears black to work on the 12th of July, and the head of department decides to punish that person? What happened? What are his avenues of appeal? What can he do to not be punished?
Actually, I heard about this. There was a hospital which had informed their doctors that they are not allowed to wear black on a certain day.
Okay.
Could we also say that all those going for formal meetings cannot wear a black suit on the same day? I think it works the same way. I think if you are going to be saying doctors cannot wear black to work, what if my department only has black color scrubs?
Yeah.
Can you sue me for having a black color scrubs? No, you can't screw me for having a black color scrub. Even our cabinet meetings or any other meetings, a lot of them wear black color suits. So can we say don't use black color suits to work? I think at least freedom of wearing the clothes I want should be allowed. I carry a black bag to work every day. In fact, I love black color pants, and I'm using a black color shirt today. This is probably the same shirt I'm going to be using on Black Monday. But yeah, I think if we are allowed to be using black suits to formal meetings, why not a black shirt or a blouse or anything that is black? Why not?
I just happen to wear black. So
I think we should do a shirt like that.
Yeah?
A shirt, I just happen to wear black.
Okay. So in Malaysia, the political movements are very colorful, literally very colorful. Every color now has an agenda behind it. This is a question by Michael Boone, which I believe Dr. Vijay has already mentioned this, both in the capacity of MMA and also in his own personal capacity, but maybe you can reiterate. Hi, Dr. Vijay. Does SCHOMOS have a clear timeline to have this issue of contract doctors resolved? If yes, by when do you think the government will take action?
I wish I had. I only have a clear timeline for myself, but I cannot state a timeline for the government.
Yes.
For example, we all had information, or we all felt that the cabinet meeting would fall last Wednesday. This cabinet meeting did not happen.
I see.
Now, can we decide for the government when a meeting is held or when results are passed? What one needs to understand is all this paperwork actually needs several tiers of approval before it is passed. Now, I cannot put that timeline for those in power. And in fact, we don't know exactly when this will be implemented. No, but personally, on a personal basis, and in terms of SCHOMOS, yes, we do have a timeline for ourselves,
I see.
meaning we need to achieve certain things on certain times. But yes, I cannot put a timeline for the government. It's like
Right.
telling them that you do this by this date, otherwise,
Yeah.
you know, I'm going to go against you.
So-
It doesn't
so-
work that way.
So roughly, what's the SCHOMOS timeline, if you can share? Just a brief outline.
Okay. As we know, the contract system was supposed to be ending this December
Yes.
2021,
Mhm.
and hence I should be in place somewhere until around September.
Okay.
So I'm trying to resolve this issue before I step down, because I don't want to be holding the position and missing out on the biggest chunk of the
see.
issue that people have been speaking about. Like I said, we are accountable, so we can't just be sleepwalking through life and saying that, you know, I was SCHOMOS president, but I did nothing.
Yeah.
So yeah,
You're right.
yeah. And I believe my exco shares the same feeling, and together with my national working committee as well, I am getting good support from all of them, and I think they have all been doing their jobs without one needs to understand that we in the association, we don't earn a single cent. We don't earn a single cent in the association. What we are doing is
Additional work.
something to take care of additional work to take care of the welfare and the well-being of doctors. While many have targeted the Malaysian Medical Association on online, I've seen those comments and all that, but if I were to pay too much of attention to those comments, I'll probably be paying less attention on the contract issues.
Yep.
So what I'd like to state here is that it's okay. These comments I will take positively, and in fact, those criticism are things that we have probably not done. We're probably not done. So I'll take it positively. Doesn't matter. But what we want you all to know is we are continuously working, and we cannot decide on the policy. We are not the policymakers. We can't decide. And in fact, the one association, this I'll bravely say, the one association that has been bravely fighting for the doctors until today, and even in fact speaking to multiple areas of the ministry and all that, is the Malaysian Medical Association. So as much as we criticize this association, this is one association that has been, you know, pushing things forward.
Yeah. And maybe the viewers may not know, but as I mentioned earlier in this podcast, Dr. Vijay is a psychiatrist in the Kementerian Kesihatan Malaysia, and I know how busy specialists are in the public sector. Okay, and for my wife is a specialist in the public sector, and I can't imagine a public servant specialist taking on an additional role. I think it's I don't know how you manage your time. How do you manage your time, Dr. Vijay, between these two tasks, these two jobs?
Okay. First and foremost, I must say that I have a very understanding boss. I wish I could thank him more, but yeah, my boss is actually quite supportive, and at the same time, I think the association as well provides me as much as possible help that I can need. We have a very good secretariat as well. The whole association on HQ, which is working from KL as well. I think I'm getting a lot of help from all of them. And in fact, I've got some other guys who are not in the EXCO or NWC, but helping us out, and also other associations, I must say. One milestone, I must say, that we achieved with all this help was from having about 2,000 plus followers and likes on Facebook. Just in this 1 year, we have 9,000 plus. So and that 2,000 plus was over the past few years. So I think this is a huge milestone in which people are at least watching us and seeing us. And in fact, if you guys don't push us, we will also, you know, be a bit sort of, you know, slowed down and all that. So I think all the criticism, I'm still going to take positively. But at the same point of time, I think we need to realize that we have not stopped fighting. And what we are fighting for are for the contract doctors.
Right. I really admire your stance, because like when you say you're fighting for, especially in SCHOMOS, right? SCHOMOS is for house officers and medical officers. You're fighting for the people after you. You're trying. SCHOMOS is trying to plant a tree, which you may not be there to sit under the shade of, right? To go even deeper, like with this whole contract doctor issue surfacing, and it really doesn't seem like working as a doctor in Malaysia is very palatable. In fact, it's gotten worse, especially when last time working as a doctor wasn't even palatable in the first place. You know, some people they start work, then they quit and become a stupid comedian. Are you worried that the new batch of medical students that graduate from medical school medical universities, they will not want to work in Malaysia and go elsewhere?
I'm actually worried even prior to that.
Mm.
I do hear families complaining that they don't want their children to do medicine anymore.
And it's a fair thing, because I don't even encourage my friends' children to do medicine, right? Would you encourage your children to become doctors?
I would leave it to them.
Yes.
I think it's more of a passion thing than a money making thing, because we can see doctors are not the richest people. I mean, for the amount of hours you put in, for the on calls that you do, for sleepless nights and all that, we are probably not the best. I know there's probably a lot of people thinking that oh, doctor ni kaya, doctor kan gaji banyak.
Tak ada, doktor miskin nak mampus. I tell you a quick story. So I was in the pre-pandemic days. I was emceeing an event, as moderating a panel lah. It was organized by Afin Huang Asset Management, and they had we had one of my former bosses, Mr. Chua is an orthopedic surgeon. He was there talking about health and all that, and then we had a lady from EPF talking about how to save for your retirement, whatever. Then one of the audience members asked a question, and then Mr. Chua, the orthopedic surgeon, is like, yeah, I wish I didn't do medicine, because if I didn't do medicine, I'll be much richer, because when you do medicine, you only know how to operate, but you don't know how to think about money. Our skills are just save the body, save the human, but how to invest, how to save for retirement, we don't know. So yeah, it's true.
And how much time we got outside to even think of something? So
zero.
I think the perception of doctor ni kaya, or I come from an Indian background also. A lot of us my son or my daughter must be a doctor lah. That's a perception that a lot of them have. So I think this perception, however, is decreasing already. So if you ask me, where does the problem now start, is actually starting from the families as well already. And in time to come, you'll be seeing lesser and lesser doctors, which is good in a way. Because one of the things that MMA had suggested was for a full review of all the medical schools. I think there are too many medical graduates and too many medical schools that are actually producing these graduates.
I see.
And a review has to be done. And that is particularly one of the reasons that these contract doctors are actually suffering.
I see.
So
right.
I think in Malaysia, we have about 32, 33 medical schools.
Wow.
And so I think for a country as small as Malaysia to have that many, I think we do need to review these numbers. Something to look forward to in the future, maybe 5 to 10 years down the line, something like that.
I remember simple back of the envelope maths would tell you that we are producing way too many medical graduates anyway. I would like to point out though that I think, although yes, the perception should change, but I always thought that doctors in Malaysia should be paid well, especially in the public sector. They should be paid well, remunerated well, because I know doctors in Australia and Malaysians who work in Australia, they are so happy, they are working well, their pathways are also secure, because one of the reasons is because they are paid really well, and I think that's the problem also in the other spectrum, where Malaysia will produce great specialists, but then they go overseas. We either lose them in the front end or we lose them in the back end, because Malaysia is not a viable place to practice medicine because of all this bureaucracy and low pay, right? Shouldn't I don't know, MMA, or shouldn't we also fight for better pay for doctors across the board?
We need to. In fact, in the slides that we presented to the ministry, one of the items that we broke up issues in terms of house officers, medical officers, and specialists. And one of the issues we spoke about for specialists was regarding the issue of brain drain. So I believe that a review and proper remuneration needs to be given for all specialists. While we consider the contract doctors issue, we should not forget our specialists as well. And there should be proper remuneration for them. And in fact, the gap between the private and public sector at the current moment is actually quite big. So, certain mechanisms have to be worked out so that this gap can actually be bridged. Saying that, we did not want to dilute too many issues, and that is why SCHOMOS decided that this time, we are going to concentrate purely on the contract issues, but we are not putting aside the specialist issues as well.
Nice. Okay. So I have a pretty interesting question here. Hold on. Okay. This is by Gunalan Arumugam on Facebook. How do you feel about the role that is being played by the professional societies and colleges, such as the Academy of Medicine, in supporting SCHOMOS? They have a lot to lose if bright candidates don't take up specializations?
Sorry, the question was if they do not come in support.
No. Okay, I'm reading it verbatim.
Yeah.
How do you feel about the role
Yep.
that is being played by the professional societies and colleges, such as the Academy of Medicine Malaysia, in supporting SCHOMOS?
Okay.
They have a lot to lose
well-
if bright candidates don't take up specialization. Means like, further down the line, no viable pathways, then no specialists, then they don't join the academy.
Okay. I mentioned that I had just had a meeting earlier at
Yep.
about 6 o'clock.
Mhm.
And actually, we had the meeting with Academy of Medicine Malaysia. And in fact, I think I'm very happy. I'm very happy with the support that has been shown by the Academy of Medicine of Malaysia, in which we believe that we are on the same wavelength. We believe that we are on the same wavelength, and we have also decided to write something in a joint statement as well, together with the Academy of Medicine of Malaysia. And I personally have also welcomed the academy so that we can work together, and also to inform all the subordinates, everyone who's under the Academy of Medicine of Malaysia.
Mhm.
And in fact, we have also approached other medical societies as well to work together with the Malaysian Medical Association. We can't see each other as a different entity anymore. It's not going to be, Malaysian Pediatric Association, Malaysian Health Coalition, Malaysian. We cannot be working in silo anymore. We need to be one, and we need to be sure and standardize to requests for what we want. We can't be having 10 requests regarding the contract doctor issue system. We need to come and streamline all our requests as one. So I think it's important to get their support, and I think we are getting their support, and we thank any association or any organization that has actually come in talks with the Malaysian Medical Association on this current matter, and in future to be having more conversations like this.
Mm-hmm. Do you think that having a health minister who is a doctor will help in your cause? Because like I can imagine that a person who is not a doctor may not understand truly the plight of doctors, but we have Dr. Adam Baba. What do you think that is a factor for our cause?
Okay, I think a doctor should be in position, because they would really understand the sacrifices made by all of these doctors. But besides just the minister alone, I feel we need to get more doctors in the ministry itself. In the ministry itself, because when we look at all these issues, we are speaking about two. One is administrative, one is clinical. So the clinical part, of course, the doctors and all that will sort out those kind of issues. But when it comes to administrative, we cannot just be looking at numbers and figures and stating that a doctor should do this. There needs to be people who understand the job to come up with administrative policies, not those who are purely administrative people alone to come up with these policies. We need people on the ground, people who understand the sentiments of doctors, and in fact all healthcare workers.
Yep.
So I feel, if you ask me for minister, yes, the answer is yes. And in fact, I feel there needs to be more doctors to be put in the ministry as well to help out with administrative related issues.
For most Malaysians, our DG Tan Sri Dr. Nur Hisham is viewed as a hero. I mean, have you dealt with him, and do you think he's sympathetic to the cause, or if you have dealt with him?
Actually, we just had a meeting with him yesterday. I think it was on Facebook.
Live on Facebook.
No. I mean, the meeting was we put up on Facebook.
Oh, okay.
We had a meeting with Tan Sri DG regarding this issue, and I think we sort of came to an understanding where this issue should be sorted out as soon as possible. In which sadly I'm not able to reveal all these details due to certain restrictions. But I think if he's not empathetic, first of all, he wouldn't have come for the meeting.
Exactly.
So I think him coming for the meeting was the first big step, and welcoming us and coming into a discussion and into an understanding of various matters. I think this itself showed that he was committed to trying to resolve this issue as well.
Well, that's very nice to hear. That's very, very nice. Again, you see, it's nice when we have doctors in the Ministry of Health.
Yep. And I think I don't know whether he remembers. I met him in 2011, and he was Deputy DG at that time. in fact. And it was great to know and work with him at that point of time. And in fact, time has passed and he's now DG. But thanks that he came to MMA. I mean, he came to our meeting with MMA, and we reached sort of a understanding of how this issue is going to be sorted out. Yep.
Yeah. Well, I think now he's stuck up to his neck in work. I probably won't remember you lah. I once performed for an event, and he was there in his capacity as DG, and I literally just asked him in front of everyone. It was an event for anesthetists. I just asked him, hey, is there any way we can get higher pay?
I'd like to know the answer.
No, he didn't answer, but he got a loud whoop like the crowd cheered and that was actually what I was for I was not for his answer. I just wanted the crowd to be on my side. Small tricks stagecraft. Here's an interesting question here from Dharmin Kumar. Are there measures? As there are measures to prevent specialists from leaving the government service, will there be more push for parallel pathways for specialization? As we now know, certain fields don't even have parallel pathways at all.
Okay. Your question was regarding the specialists.
Yeah, I think is there more push for more parallel pathways for specialization? Because right now I know there are certain specializations that don't have a parallel pathway. You must be in the master's program. So are there push for separate pathways so that people who may not be in the master's program, who are not eligible for masters, they can apply for external papers to become specialists? So are there pushes for more of these pathways?
Yes, there is, but this would be probably better to be discussed with the conjoint board and all that, because these are the people who are actually in charge and coming up with the logbooks and gazettement material and all that. Yeah.
I see. Okay.
Even if you're in the parallel pathway now, you still have to go through the logbooks, gazettement and logbooks and all that. So they're trying to synchronize all of that. I think different committees are coming up with different plans, different durations of gazettement and all that. So but there is surely a push, and I think this was actually rooted by our previous Deputy DG Tan Sri Jendran, who was actually very much in line for the parallel pathway. Yep.
Right. Okay. So I think this is a good time for me to clarify for all the listeners out there who may not be in the medical field. When a doctor has started working, of course, one of the ambitions is to be a specialist. Now in Malaysia, there are two pathways. One is the I would say the public pathway, where you apply for the master's program. This master's program is centralized by the Ministry of Health. But there are also other types of exams that you can take, and we call it external papers, where, for example, instead of applying for the master's program, which is coordinated by the Health Ministry, you can also apply to, let's say, the Royal College of Physicians in the UK, and then you apply to that. You sit for papers independent of the Health Ministry. Then when you pass that paper, you then are allowed to be gazetted as a specialist in Malaysia, even though you didn't take the normal master's pathway. The problem is now, contract doctors, even if they pass the papers in the external program, they still cannot gazette as specialists in Malaysia. That's the problem that we're facing now, right? Have I got it right?
Yeah, correct. I think I think what would release the burden on them would be at least if they had a method of career progression. I think that really matters, because you just imagine you study for 5 to 6 years. I mean, the place I graduated from, I studied for 6 years. The place you graduated from, probably 5 years. So we're talking about 5 to 6 years of study, years and years of collection of money from our parents. Some of us even had to take loans and all that. Yeah. And then another 2 years of your housemanship here. And then after that you have about 2 to 3 years to complete everything. I think it's a bit difficult.
Yeah. Here's an excellent suggestion by Jowin Go. Since everyone is taking selfies when they get vaccinated, may I suggest that those who stand with code black just wear black whenever they go for vaccination? Now, I think this is an excellent suggestion. What about you, Dr. Vijay?
I wish I had thought of that.
Right?
I wish I had thought of that. I think it's excellent.
We can start pushing now.
Yeah, I can start pushing now. Yeah,
because,
exactly.
The current, at least for AstraZeneca, is going to last until August. So we have ample time.
True.
Imagine every selfie out there, people wearing black, #code black. I think that's brilliant.
Yeah, I think brilliant. I think that's why we need people like this on the program, actually, really.
So this is by Jowin Go. Shout out to Jowin Go. That's an excellent suggestion. Are you in the PR line by any chance, or social media digital strategy? Because that's excellent. That is genius. Well, it's so simple because we know everyone will take selfies. So why not just wear black? Hashtag just wear black. See, I just gave you a new hashtag. Hashtag just wear black. Okay. Or black with vax, something like that. Another question by Hardy Amin. Recently, the first batch was offered one-off contract for another year for COVID purposes. Does MMA or the junior doctors expect that there will be better offers before the end of their current contracts?
Yes, and MMA does not actually support the purely support the 1 year one-off contract extension, because as I've mentioned in my interview with Awani, it's akin to treating the fever but not finding out the underlying cause.
Kicking the can down the road, right?
Yeah. So I think we need to resolve this issue. We can't be just looking at a short-term solution, a long-term solution. So yes, there are plans actually being put in place, and this 1 year extension is actually a temporary extension which has been done, so that while the actual plan comes out, there's this 1 year extension in place. But why I do not support this 1 year extension? One is because there's no guarantee. Number two is every time there's a new contract, there's also new conditions. So that conditions may not be the same with previous conditions, and that is why I feel that in terms of benefits, leaves, perks, and all that, it should always remain the same.
Exactly.
And why I'm saying that is because I'm going to give a very good example that I just learned a few minutes ago during the previous meetings. If a retired medical staff can be kept on contract and still have the same benefits, why not the junior?
Exactly. So, now, just to clarify again for the listeners, for the viewers out there, sometimes when permanent doctors or healthcare staff they retire, they're given all their pensions, whatever. But sometimes they get bored. They are sometimes invited back into the system, not as permanent, but on a contract basis. But all the perks are exactly the same as if when they were when they were working as a permanent staff before this. Am I right, Dr. Vijay?
Yeah. Of course, I wouldn't say 100% the same, because perhaps they were on pension and now on KWSP, but at least in terms of leaves, allowances, those kind of things, because how do we differentiate two people doing the same job with different sort of benefits?
Exactly. So I think it's a good point you bring up, because now that we all know that they actually can do it, the mechanism is not hard to figure out, right? It's not it's just copy and paste, right?
Yep.
Right. Okay. There's an interesting question here early on by Ravi. Ravi Marutamutu. Okay. What will be the next course of action if the current proposal to kill the contract position is not materialized? Meaning, if say all our efforts fail, what's the next plan?
Okay. As I mentioned, there's going to be a petition that we're actually going to go about.
Yep.
Yeah, there will be a petition. So that will be the next plan. And failing the petition, there will be further plans coming up down the line. So the next online would surely be a petition. In fact, there is going. It's always bad if we actually go in and simply say, no, give us a position, provide us the money, but we don't find the solution for it as well. So MMA is also doing a sort of a research as well in terms of that, and we are going to propose this the results of this research to the government as well. And we would also love to engage with the powers to be, and in fact, if even with JPA and all that, if possible. So we are looking at all of those possibilities. But if you ask me, the next course of action would be the petition first.
Okay. There is a very, how to say, a progressive question by Nur Liana Hanapi. Are there proposals to actually push for non-clinical specializations, i.e. medical law, health economics, health informatics, and etc.?
Very interesting question. During this time, the answer is no. I'll admit the answer is actually no. But yes, there are actually push by certain groups as well for health economics, health law. And I can surely second this because I was on a phone call with one of our national economists yesterday, and I did ask him about health economics, something that I thought I could do on the side, something just for me to learn
Wow.
about,
Nice.
something just for me to learn about how we can work out this economics side of health, so that we don't have to discuss where money comes from, how do I find the money. If I could be the one doing it, it would be way much easier. I can't mention who I spoke to, but a very prominent economist in the country. So yes, there is push for things like health law, medical law, health economics and all that. Yes, there is a push, but at this current pandemic and scenario, yes, MMA is not pushing for it yet, but there is a push. There is a push. We do have subcommittees under the Malaysian Medical Association, which are looking into this as well. But for SCHOMOS side, we are mainly looking into the contract doctors issue, number one, and the other issues will be for house officers and specialists.
Right. Okay. So there is some move or efforts in that direction.
Yes. In fact, there are multiple medical law health topics, webinar and all that going on. If they stay tuned to our MMA webpage, in fact, this current team has done quite a bit, in which our whole webpage is going to be revamped. So we're in the process of that, and in time to come, will be more interactive.
Yeah. There is a interesting a suggestion here. By the way, we have done more than 1 hour. That's amazing. We have a lot of questions. Great discussion. By Aizat Hassan, a suggestion really. Hi, do you believe a longer contract, 7 to 8 years, will be beneficial for us? Point number 1, 7 to 8 years contract to allow these contract doctors to be trained for specialization. After 7 to 8 years, if you complete your specialization, you will get an offer of another 10 years contract or permanent position. What do you think of this suggestion?
I think Aizat has read our slides. Okay, this was one of the proposals.
He came prepared.
Yeah, he came prepared. This was one of the proposals I put in. Now, we do stick with our stand that permanent positions should be offered, because permanent positions are not sufficient in the healthcare sector. We need more. We need more for sure. And I think KKM itself came up with a poster where human resource is being downsized at times by 1% or something like that. I can't remember where I saw this exact poster, but it was by Public Health Malaysia, if I'm not mistaken. So yes, we need more numbers, but at the same point of time, while we increase these numbers, the extended contract is an option that has to be taken into consideration. And this extended contract is not a 1 year, 2 year, 3 year kind of thing. I think it should be at least done for 10 years.
Right.
Why I think 10 years, 2 years housemanship. You must remember that a doctor might be sent to district.
Yes.
I'm working in Sarawak. What if I'm sent to district and I can't come back to do my specialization in that period of time? So what happens then? Or a doctor is affected by TB or pregnancy. We have to take all of this into consideration. So I think there should be a good enough time. And then subsequently, once they graduate, they should be offered the permanent post in the government service.
Okay, so I think here's a good time to wrap up. I'll just say a few of my thoughts here. Number one, although yes, times are bleak now, both for Malaysia and also for new doctors, but I do feel that there's a silver lining behind all this, because right now, all the young doctors, all the junior doctors, they are kind of forced into a form of activism. They are forced to speak up, to say, hey, this is not right. We should do this. We should improve this. And the reason why I say it's nice to see this, because 12 years ago, the amount of activism among new doctors, even senior doctors, wasn't there. Everyone just kept quiet, and then never mind, we just pass through housemanship, pass through masters, and then become specialists, and then that's it. Rarely anyone spoke up. And I would argue that the problems we face today is because the doctors of previous generations did not speak up. But now when I see all these like hashtag Code Black, strike and Black Monday, it makes me happy, because finally, for the first time in recent memory, doctors are willing to speak up. The junior doctors are willing to speak up for themselves, and the senior doctors are willing to back the juniors up. So these are all, to me, great improvements, great achievements in the whole voice of doctors in Malaysia. What do you think about this, and what are your final thoughts on this whole hashtag Code Black MY movement?
my final thoughts are, I hope we succeed. Personally, I hope we succeed. The faster, the better, so I can rest. I really do. Yeah, I really do hope that we succeed. But even if we don't on the 12th of July, we will still move on. We will still move on. And I agree with you that currently, this is my message to the juniors. I know a lot of y'all are worried about the position. And in fact, we are as worried as you. Because one day we will all fall ill, and it will be you who's treating us. You need to become specialists to be able to treat us as well. We understand the fact that specialists are required, and we are pushing for all the specialists to get a clear chance of being one. So I think my last message to everyone would be, let's not look at junior senior. Let's not look at permanent contract. Let's not look at MMA being a one organization or anything like that. I'm just going to make it simple and say that let's look at us as doctors and healthcare workers. I keep mentioning healthcare workers because I think we are all on the same boat. And in fact, I spoke to even like radiographers, lab technicians and all that. And I think they are also on the same boat of the contract system like us. And I would like to alert everyone that these healthcare workers are people in the background, those processing your blood, those taking your x-ray and all that. These are also allied healthcare workers that need to be looked into. So let's look at healthcare workers as one. Let's work at this together. Those who want to work with MMA, we always welcome. Those who do not, it's okay, but do not condemn those who are trying to support and work for the contract workers. We will still continue working no matter what is said and whatever is criticized about the association, but we will still continue to work for all of you.
All right. I do not have how to say in immersive experience with MMA, but having just spoken to you for an hour, I think we are in good hands, and I wish you all the best, good luck, and Godspeed.
Jason, one last thing, Jason.
Yes, please.
Don't forget to wear black.
Yes.
I know you've got loads of followers and loads of friends, people in the media and all that. If you could just spread the news about wearing black on 12th of July and, changing a profile picture to black and white and, whatever they can be done to support the doctors.
Yes. And let's do that. Okay. And by the way, let's just reinforce that amazing suggestion. Just wear black. Everyone's gonna get vaccinated. We have 300,000 a day getting vaxxed. So if we all wear black, that's gonna be even more powerful than just petition signing, right? So let's just wear black when you get vaxxed. Oh, that's catchy lah. All right. Okay. To all those of you viewing and watching, thank you so much. This has been a really important discussion for the future of our doctors, healthcare workers in Malaysia. Thank you so much, and once again, thank you, Dr. Vijay. Thank you very much.
Thanks, Dr. Jason.